Dr. Susan Pike. I'm a plastic and reconstructive surgeon at Baylor Scott & White Healthcare in Austin, Texas. I'm also one of the fortunate people to be a first Walk with the Dog leader in Texas. And I want to give a shout out to the Texas Medical Association and to the Texas Medical Association Foundation for their support. Today I'm going to talk to you a bit about the coronavirus, COVID-19, and return to school. As a parent, I have spent a lot of time and trepidation on this subject, and I still don't have the perfect answer. But I think the key is to find the right answer for your family. I'm going to refer to texmed.org several times during the talk because there's information available there for both physicians as well as for the community and for those in schools that will be very helpful. Okay? So I just want to give you a little background to start with. So for weeks, educators across the country have been pulled in different directions about reopening. On one hand, many parents have struggled to balance work and teaching their kids at home. On the other hand, some teachers, staff, and parents have been pushing for online learning to prevent further spread of COVID-19. Schools across the country, communities across the country, have taken different approaches to this. The bottom line is this: with more than 5 million coronavirus cases in the U.S. and with over 170,000 deaths in the U.S., schools have struggled months to figure out how to reopen safely for families, for teachers, and for staff. As of now, when more students are heading back to school, there's still no easy answers to do that. However, I have some guidelines and some references that I think will be helpful for you, like I said before, to make the best decision for your family. So I'm not going to review the symptoms of COVID-19. We've all been inundated by them, and they're easy to find on the web. But what I want to tell you is the exposure definition, because I think this is going to be important for parents who have children returning to school. So a student is considered to have been exposed if he or she has close contact with a person with a confirmed, meaning a test positive, COVID-19 within the last 14 days. Also, if they've traveled to an area with high community transmission of COVID-19, as identified by federal, state, or local health authority, or if they live in an area of high community transmission, again, as defined by the local health department or authority. One very important thing right now is your student will not require a COVID-19 negative test to return to school as long as they have been asymptomatic or are 10 days post their exposure without symptoms. So I'd like to go over 8 guidelines that the TMA has established to achieve a successful return to school. So the first thing is consult official guidance and best practices. So there is a list of resources, again, at texmed.org, from the CDC, from the American Academy of Pediatrics, from the Texas Education Agency, or the education agency where you live, from the National Academics of Science and Engineering and Medicine, and finally, from Harvard. 2, identify potential vulnerabilities. The idea is that measures to interrupt that respiratory droplet transmission, such as physical distancing, face coverings, and hand cleanliness, are absolutely must-haves. 3, help schools troubleshoot. So here's the idea. Every school, every community, every family is different. So we need resources and facilities that are able to manage COVID-19. It's going to be different for every one of your communities, but help them out by providing feedback and resources. Number 4, we want to counsel our families. So many schools are offering families the choices between in-person and remote learning. There is a great CDC resource called Families Deciding How to Go Back to School. Again, you can access that through the CDC or at texmed.org. 5, let's consider high-risk activities. So remember, nearly any school activity has a potential to be a high-risk activity if appropriate precautions are not observed. So, mask wearing, hand sanitization or washing, social distancing. Number 6, encourage school collaboration with local health departments. They need to be closely collaborating to minimize the potential for outbreak. And they need to be closely collaborating so if there is an outbreak, it can be appropriately reported and people protected. Number 7, follow the CDC and local health department guides for evaluation and treatment of children with COVID-19 symptoms. So those children that are evaluated and are symptomatic for COVID-19 need to be treated in accordance with the CDC guidelines. We want to communicate case findings, okay? That will permit quarantining of the child's potential contacts if necessary. And finally, report probable and confirmed cases of COVID-19 immediately. Remind patients or people of appropriate isolation and quarantine protocol. Anyone in a household with a confirmed COVID-19 case should quarantine at least 14 days from their last contact with that person. Be familiar with return to school recommendations from, for instance, your education association, the CDC, and your local school district. No negative COVID test should be required for your child to return to school. Finally, encourage universal mask wearing at all times practical. That is key. Remember, this is a respiratory droplet transmission, highly transmissible. We haven't seen anything like this with the common cold or the flu that we usually see. So almost all people over the age of 2 are really capable of wearing a mask safely. And that's what we need to do and encourage of others. Make sure that it has the correct fit as well over the nose and the mouth. So does your school's infection control plan stand up to COVID-19? What you're looking at now is the Texas Medical Association's 4 Sturdy Legs plan. Basically, 4 Sturdy Legs stabilize a robust plan. Plans should closely follow the CDC and control and prevention guidance. There are 4 legs. So the first, adopt safe procedures, such as physical distancing of at least 6 feet. Students grouped in pods to limit mixing with others. Staggered attendance and limiting visitors. The second leg is to require safe behaviors, wearing face covers correctly, practicing hand hygiene, covering coughs and sneezes. The third leg is to create a safe environment with ventilation, disinfection, plexiglass barriers, contactless fixtures like wastebaskets and paper towels. And the fourth leg is to manage sick students and staff, daily symptom checks at home, isolation of symptomatic students and staff, and methods to communicate with caregivers of a sick child. Remember, COVID-19 has high community transmission and can overwhelm even well-crafted plans. COVID-19 cases and outbreaks may result in quarantines or campus closures, even for the best laid out plan. The last thing I want to share with you is a decision tree tool for school nurses. I'm not going to hold it up or go through it because it's an algorithm and it's fairly complicated. But I want you to understand it's available to you, whether you are a physician or public, at texmed.org. That's texmed.org. I want to give a special shout out and thanks to the Texas Medical Association. I am a privileged member of an organization that supports physicians and our Texas communities like no other. Please join us again at texmed.org, texmed.org for more information. Thank you, and walk safe.